OCD is one of the most misunderstood mental health conditions, and that misunderstanding keeps a lot of people from getting the right kind of help. Hi, I'm Dr. Tom McDonagh, a psychologist at Good Therapy SF. OCD is one of the conditions we treat most often at our practice, and it's also one of the most misunderstood. People often delay getting help because what they're experiencing doesn't match what they think OCD is. The good news is that OCD has one of the most well-researched and effective treatments in all of mental health. So here's what OCD actually looks like. OCD is not about liking things to be organized or wanting a neat desk. Obsessions are unwanted, distressing thoughts, images, or urges that get stuck in your mind. They often involve fear of harm, contamination, doing something wrong, or losing control. So compulsions are what you do to make the anxiety stop. Compulsions are repetitive behaviors or mental acts done to neutralize the obsession. They can be visible, like hand washing or checking locks. They can also be completely internal, like mental reviews, silent counting, or seeking reassurance. Many people with OCD don't realize their mental rituals act as compulsions. So the cycle is what makes it OCD. The defining feature is not the thought or the behavior on its own, it's that loop, the obsession that creates the anxiety. Compulsion temporarily relieves it, and then the brain learns to keep doing the same cycle. Over time, that cycle takes up more and more of your day. So here's what effective treatment looks like. Exposure and response prevention is the gold standard. ERP for short is a specific form of cognitive behavioral therapy that has the strongest evidence for treating OCD. It involves gradually facing the situations that trigger your obsessions while resisting the compulsion. Done well, it works, and it works for most people who stick with it. Medication can also help, but it's not always required. SSRIs can reduce the intensity of OCD symptoms and make therapy more accessible. Many people benefit from combining ERP with medication, especially when the symptoms are severe. Some do well with just therapy alone. And then, like most things, the right therapist matters. Not every therapist is trained in exposure and response prevention. General talk therapy can actually make OCD worse by reinforcing the reassurance-seeking part of OCD. So if you're looking for OCD treatment, ask whether the therapist has ERP training and OCD-specific expertise. If you think you might be dealing with OCD or you've tried therapy before and it didn't help, reach out to Good Therapy SF. OCD is treatable and we can help.